Hi guys, today we are talking about cardiogenic shock. And before we get into the specifics, I just want to kind of provide an overview that shock in general means we're not getting enough blood to the body. Okay. And so depending on the cause, that's how we're going to know what the type of shock is. Okay. So cardiogenic shock is complete pump failure or complete heart failure, which causes the loss of that oxygenated blood flow to the body. So in this situation, our heart is not pumping, and that's why we're having this issue with shock. Okay, so let's talk about some general causes for a cardiogenic shock. Obviously, a myocardial infarction. We might have somebody with end-stage cardiomyopathy, possibly a papillary muscle or a valve rupture. We might have cardiac tamponade or a pulmonary embolism. Okay, so any of those things can lead to this heart failure, this pump failure, and to cardiogenic shock. Now let's talk about assessment. What are we going to assess in this patient? The first thing we're going to look at is sudden, severe, or extreme heart failure. The second thing we're going to assess for is decreased perfusion. Okay, so we're going to see decreased cardiac output, decreased blood pressure, increased heart rate is going to be compensating. It's going to be trying to compensate. We're going to see increased SVR, also trying to compensate. We may see weak, thready pulses. Pump isn't pumping effectively. It's not strong. We're going to have cool diaphoretic skin. Is, hey, that blood, it's warm, right? So if it's not there, if it's not getting throughout the body, then we're going to be cool, pale, dusky, cyanotic, or mottled skin. We're going to have decreased urine output because again, the kidneys, they really need that blood flow to properly, get urine produced and excrete what we need to excrete. Decreased fluid, decreased urine. Next is decreased level of consciousness and some anxiety. Okay, so that's decreased perfusion. The third thing is volume overload, volume backups because the pump can't pump, right? So we technically have enough blood in the body. It's just not going to the right places, right? It's getting backed up in some places and not enough in other places. So what we're going to see as a result of this volume overload, we're going to see jugular venous distension. We're going to see increased CVP, and we're going to see pulmonary edema. So where is it getting backed up? It's getting backed up near the lungs, and so we may see some fluid retention there, we might see as crackles, pink, frothy sputum, sudden, severe shortness of breath. So therapeutic management for these patients. The most important thing is to treat the cause of the pump failure. Right, so for an MI, we're going to look at revascularization, percutaneous coronary intervention, coronary artery bypass graft, whatever's going to help us make sure we get blood flow to the heart so it can pump. Second would be thrombolytics or surgical removal for a pulmonary embolism, or a pericardiocentesis for cardiac tamponade. So again, we're going to treat the cause of that pump failure. The second thing we're going to do for therapeutic management is we're going to work on improving contractility. So we may use dopamine to increase the heart rate or dobutamine. We're going to help decrease the afterload with dobutamine and diuretics like furosemide for the pulmonary edema. But we need to be careful because it may decrease the blood pressure, and that's not good because we're having issues with blood pressure for these people. So again, shock in general, we're not getting blood flow to the body. Cardiogenic shock is because of the heart and the heart not pumping. All right, so thank you guys and happy nursing. This has been another episode of NCLEX Flash Notes podcast, your no-fluff study companion for NCLEX success, providing exceptionally clear and concise content to conquer the NCLEX exam. Now, if you want to follow along while you listen to this show, you can head over to nclexbook.com to get our free ebook, NCLEX Flash Notes, with 77 must-know NCLEX nursing topics. And as a bonus, you'll receive 16 full-color nursing cheat sheets. Don't wait. Visit nclexbook.com today. That's nclexbook, NCLEXBOOK.com. Happy nursing.